very interesting topic for you all. Today we're going to be talking about artificial intelligence in healthcare. For those of you all who do not know, my name is Janique. I am a nurse, and I've been a nurse for 19 years. And I've seen a lot in nursing over that time. Different challenges, different things that are good, a lot of takeaways, and we're still going, okay? So I also have a master's degree in nursing, which includes the area of nursing informatics. So I find technology and how it can be useful in the area of healthcare to be very, very interesting and can be very helpful, right, in improving healthcare and the workflow. So I definitely am interested in this topic today about artificial intelligence. And let's face it, healthcare affects us all. So this is something that can affect you at some point in your life, whether it's going to a doctor's office, whether it's going to a hospital, or even just staying at home. Artificial intelligence is not anything new. It has dated back, I believe, all the way to the 1940s. So it has been around, but of course we have made progression since the 1940s. And so now we are looking at the area of healthcare. And I think in 2023, and as we move forward, technology is definitely going to be integrated into healthcare, and just to see how far it goes and what level and what our healthcare system will look like in the future is going to be very interesting. But no doubt artificial intelligence will be a part of that. So let's get into it today. So no doubt that we saw a lot of changes during the pandemic, right? So we saw the use of video conferencing, the use of Zoom, video calls. That's how we had to conduct our appointments. So in order to service clients at that time and service patients, a lot of business saw the change of workers working remotely, different things going on. In nursing, we saw a lot with travel nursing. And there's a great debate between travel nursing and staff nursing, but we saw a lot of nurses go into travel nursing, leaving their regular normal staffing positions. And yes, a lot of nurses even left during that time. Talk about burnout. A lot of nurses went through that phase. We've seen a large exodus of nursing and a great shortage, whether they went into different areas or of nursing away from the bedside, or whether they just left nursing altogether. Okay, so the pandemic caused a lot of changes in many of our lives, including the way we live and in the way we work. But at any rate, with those high levels of burnout and stress, we have been struggling to maintain the healthcare workforce. And guys, you will see me look down because I do have notes and some articles that I want to bring up during this discussion today. Okay, so the first article I'm going to go ahead and get into is entitled 5 Healthcare Trends to Watch in 2023. Okay, in this article, Sad Chandri, he's the Chief Digital and Information Officer of Maryland Luminous Health, and he stated, healthcare innovation will focus on 2 areas in 2023. Augmenting and in many cases automating operations to improve workflows and reduce stress and burnout, and moving beyond simple solutions that address how patients access the healthcare system. Of course, we know access to healthcare is very important, and before we can even get into talking about more specific things, we got to figure out how our patients are going to access that healthcare, and do they have the means, and what are the challenges even with that. So with higher rates of staff shortages, burnout, stress, technology and AI will become more of a priority in how we deliver care. And it will allow for better workflows for doctors and nurses. That we are often, you guys, nurses and doctors, especially I'm going to speak for nurses because that's what I know. But we are often taken away from nursing specific tasks that nobody else can do, or don't have the skill set to do, that we can say, hey, you do this, because that requires a nurse or requires a doctor to do that, right? So there are a lot of mundane tasks, or just tasks that doesn't require that skill level that we are doing that is taking us away from direct patient care. So if there's a way that those tasks can be automated or technology can be used to help with those tasks, that will allow us to focus that time and put it more into direct patient care, or that's care that's going to produce a better outcome for our patients. Okay, so that's one way that AI can help us. Artificial intelligence can help us. Okay, so with that being said, you guys, I have seen this robot, okay, called Moxi, and I'm gonna try to put in a picture or something here so you can see exactly what I'm talking about. But Moxi is a robot that uses AI. Okay, Moxi is used to ease worker burnout for tasks that can be automated and do not require a nurse. And I will link a video so you can see for yourself on a video about Moxi. Okay, but Moxi eliminates that burnout and those mundane tasks that can be automated and don't require a nurse. Moxi uses that machine learning form of AI where the machine learns. The more you use it, the more it's going to learn that task. It uses an AI navigation system that allows us to do these mundane tasks. If you're a nurse, you know there are tasks that do not necessarily require us to do, but that we find ourselves having to do because we're short-staffed. We gotta, they're looking at the nurse. A lot of times things gonna go back and they're gonna say, who's the nurse? Who's the nurse? And it could be this paper fell on the floor. Who's the nurse? It could be simple, okay? But it falls back to the nurse. So if we can eliminate the mundane tasks that doesn't require our skill set, that would be great. So what are those things? Okay, so things like going to the pharmacy, picking up medicines. These are things that Moxi, the robot, the robot that uses this AI does. The Moxi is known to deliver medications, labs, stocking rooms. Like when you have a new admission or a new patient, they can set the room up. It does errands, so going to get those medications from pharmacy, those tasks that we have to do, such as delivering labs to the lab or blood work to the lab, going to pick up other things from other units, taking things from room to room. Okay, we can utilize AI robots such as Moxi to do these tasks. Okay, and even at one hospital in Texas Dallas Health, they're stated to be using Moxi. Now, that was at the time when I did my research. They were using Moxi, as well as Christian Care in Delaware using Moxi. These are just two that I saw that were already using this type of technology. So yes, they are using Moxi, and Moxi is logging steps, okay, miles, that would otherwise be done by the nurse. And from one video I saw that Moxi had logged like 100 miles. Now this is eliminated by the nurses that will have to do all of these extra steps, extra processes that really can be outsourced or done by AI and things such as Moxi. So what a great tool they are using to help them. And one person on the video even said that they use a Vocera, and they use their Vocera to call up Moxi. They can also use a kiosk to have Moxi come and pick up things or request Moxi's help, almost like Uber Moxi. Moxi is going around, okay, and everybody loves to see Moxi, okay. So that is one way AI is being utilized. Now, during the pandemic, AI was also used by another form of technology. They used an AI system called Grace, and Grace is like automated robot that appears human that they used during the pandemic time. So AI has been used, is constantly being used, coming up with different algorithms, different decision-making steps and things that we can do to better service the client, because whereas the human has to take several hours, time, days, going and sorting through all of the history, data from the patient's chart, so forth, and gathering things from different, sometimes different healthcare systems. Like if they went to one hospital, come to another hospital, different forms. AI can go through all this data and analyze it in short amount of time, and then come up with treatment options and different diagnoses and so forth, and how to treat the patient. It saves time, which could mean so much in healthcare and diagnosis, where time is everything. It can help predict things such as when sepsis alerts in the hospital, which sepsis is a big thing. So if you can have the AI system to help you to predict somebody going into sepsis at a quicker rate than what a doctor or nurse may discover later, then those patients can be treated quicker, even like cancer patients. And it's just a lot of great technology. Of course, there will be limitations, but there is a lot of advantages with AI, but there definitely needs to be a lot of data gathered, because, you know, we talk about people's lives, right? So, okay. So back to the article. So yes, and this is the article keeps addressing AI and the different trends that we will be seeing in 2023. Like I said, I find this topic to be pretty interesting, as this healthcare affects us all. Okay, so AI can not only help healthcare workers, but they can improve patient satisfaction and outcomes. Even like with the Grace robot during the pandemic, was able to take patients' vitals, able to talk with them. Like sometimes patients just wanted to talk and to socialize. I mean, think how much that time frame limited us in our interactions with others. So that was great for social stimulation. It helped with therapy, vitals, assessing care, so many different things and helpful ways that this AI was employed to help patients and produce better outcomes. So through clinical decision support systems, AI can offer the clinician tools that can eliminate errors and provide a guide to producing the best possible outcome. Now, AI can also be used in different forms of nursing and patient care. A lot of times patients come to the hospital, you guys know, like you go to the hospital, you don't want to go in the first place. You got to go there and you got to get your care. Sometimes you face long lines. You get there, sometimes you go through different steps and headaches. Unfortunately, that's things that you encounter during your stay, and different things where you rather be at home and then just to get the care that you deserve. So some people do home health care. So with home health, AI has allowed an improvement in home health care by allowing more patients to heal where they live and be surrounded by family and their loved ones. So as healthcare works through its shortages, we know there are shortages and it's not just nursing shortage, it's the respiratory therapy. We see shortages with phlebotomy. So oftentimes as nurses, we are drawing blood. You know, we have encountered, and sometimes respiratory therapy, there might be one and they got several units to cover. So there's a lot of shortages all the way around. I think we talk about or look at nursing more so, but I think we feel it's palpable, you know, in the hospital, especially when acuity is high and so forth. We want to provide the best possible care. So we need to look at these different options and how they can be used to better improve the healthcare system as a whole and better improve patient experience and satisfaction. And if we go back to patient-centered care, then we can really see the benefits that it could really have an impact on quality of life and so forth, even cost reduction, so forth. So as the healthcare system works through its shortages, including shortages in nursing, respiratory therapy, and phlebotomy, AI can offer much needed assistance. Okay. Now, I looked at this article according to HealthLeaders article. It says, in addition to hiring and retention efforts, and flexible scheduling, automation through technology such as artificial intelligence or AI, machine learning, and natural language processing can ease workflow shortages. So this will definitely help. It will help to retain nursing staff and other staff because it's lessening the load. It's allowing for a easier workflow. So this is definitely something I think hospitals and healthcare systems would benefit from looking at. In healthcare, workers want to do this, according to the article, and I totally agree. And healthcare workers want to do meaningful work that does not take away from patient care, but adds value to the patient care, right? So the tasks that you got to do, keep running around, running here, deliver this, deliver that, do this, do that. I mean, if we can eliminate some of those back and forth, running errands and so forth, then we can be better available to our patient. We shouldn't have to have a high acuity on the floor and then go run here to pick up something or go here to deliver a lab when there is technology out there to better assist us in providing top care. So I think it's a balance and definitely something that deserves a discussion, right? So yes, so the in healthcare workers definitely want to do the work that's better for the patient. Okay, so I want to read this part that's from the article as well. And this is from Mr. Eric, and I'm going to say this last name wrong, Oglu, and he is the former executive vice president and chief medical and scientific officer at Novant Health. So Mr. Oglu says, and I quote, "A lot of people advocating for AI and machine learning are talking about clinical decision making and clinical support. You hear a lot about automating revenue cycle management. We need to focus on nursing. There are companies, right here guys, that are working on developing natural language processing for documentation, which can take up to 50% of a nurse's shift. We must eliminate that documentation burden." Now, to all my nurses out there, you know that documentation is very important. If it ain't documented, it ain't done. And so it's very important to document. So we have to make sure our documentation is done. But the thing is, it does take up quite a bit of time that the nurse has to do the documentation. And you even hear from patients when they come from the ER or they're admitted, and they'll say things like, "Well, I just answered these questions. They just asked me that," or and then they want to make sure that isn't that in the system? And some systems, there are some that may do this, but some systems don't cross over the information, so it's not across the board. And you asking the same question. I really think technology is much further along than that. But some systems are still lagging where it's not easily transferred and uploaded across the board. So then you're asking the questions again, which takes away from the patient. Like, I just explained this and went through this, and again, here they are. So, and then with documentation, we know we're using our electronic health records, but at the same time, the technology, I believe, is there to definitely improve documentation that takes up so much time away. So we that is definitely an area to look at, and I'm glad that the article recognized that it takes a large part of the nurse's time. So okay, again, with AI, that is definitely something, an area where it can help. It can also help through, you guys know, with the those of you who have Apple products, with the Apple Watch, how it can monitor your heart rate rhythm, tell you if you have an irregular heartbeat. We got things like Cardia that can tell you if you have an irregular heartbeat, and so forth. So there is technology out there, like wearable type devices, where that can help with healthcare as well. So these, there will be maybe even more growth in that area where they can detect the information and not only just put it through to a cloud, but to be just right there, just machine learning and having all that data compiled. So this is some great area of study and discussion where these devices in acute care facilities will definitely help with mundane tasks like vital signs, different things, and even picking up on things like sleep apnea, like so they can detect it and perhaps patients can get treatment quicker and know about these things. So it's really interesting. Okay, so the article does go on to say Mr. Eskioglu that he predicts, this is a quote, I predict, this is according to Mr. Eskioglu, that by the middle of 2023, you're going to start to see a separation between the health systems that modernize and automate workforce functions and those that don't. The innovative health systems are going to attract staff by being able to create a work environment that is inviting and less prone to burnout. So for those healthcare systems out there that is looking for nursing staff, that is looking for respiratory staff, that is looking to retain its employees, you know, it's worth looking at the technology so that you can create an environment that I would say appreciates and wants to bring that satisfaction to their patients, to their staff, that eliminates that workload for their staff, creating an environment that is inviting and less prone to burn out is going to be very important. Look, older nurses are staying, but younger nurses, when I say younger, you know, they come in, but then they'll leave because there are not things in place, systems in place that allows for a easier workflow. The chaos and the technology and the systems that's lagging and so forth, and the equipment ain't right and things are not updated, and then you got to keep running here and there and here and there, and then we want to be nurses and nurses want to be doing patient-centered care, not the errands and stuff like that so much, you know. We recognize that those are things that we have to do, so we do them. But why not look at technology and this artificial intelligence and to see how it can improve the healthcare systems? I think healthcare is definitely going in the direction of using the technology, and I do believe those ones that don't will probably fall behind, because a lot of people are moving toward, a lot of people don't come in the first place, and then when they come, if they're not going to get even patients, I'm saying, like when they have to come to the hospital, they want to get great care, and they don't want to see the chaos and their nurses being taken away because they got to go here and pick up this or go here and do this, when that doesn't really require nursing. So yes, this is a very, very hot topic. It's been out there, but it's, I think, moving more in the direction of where you're going to start to see more of it, and how will it affect your health care. And when you go to the doctor and when you go to the hospital, like seeing those forms of automation. Like some patients don't want to be woke up all the time to get their vitals. So what ways can we get their vitals through AI, through collecting that data, where we don't have to keep going to wake them up for vitals? Now, of course, there's going to be times where you're going to need a nurse. You might have to go in like eyes. You need to do certain assessment skills. These processes and algorithms and clinical decision-making tools and helpfulness of AI is to aid the nursing staff, to aid the doctors in providing the best care for the patient, and working together. I think that makes it stronger, working together, and being able to sort through the data, analyze the data, and so forth. Now, with AI, of course, we know, like I said, there are limitations. And the article even alludes to this, that the most prominent barrier holding back AI adoption in highly regulated industries in healthcare is the highest level of accuracy necessary to achieve adoption. So we definitely want to be accurate because we are not messing around with just machines, so to speak, but we are dealing with people's lives. So we don't want any errors. We need a lot of data collection on this topic, and we also need to allow for cultural type differences. We need to learn to allow for that every model is not a one size fit all type of thing, but to get data sets on different areas so that that machine learning and so forth will be useful and not harmful. So it takes, I think, it's going to be both. It's going to be the doctor, the nurse, the AI, not just AI, because you still need the doctor and the nurse. You still need people in place as well. But I think it can be a great tool to use to further healthcare. But this is a very interesting topic, so I will probably do another video on this at some point. But yes, I wanted to let you all know that healthcare is AI is out there, right? We see Siri, Siri, and way we can talk to Siri. We see Apple Watches and how they could collect data. We see different things all around. But yes, that AI is definitely a tool that we can use to provide better patient outcomes, to reduce those mundane tasks, different clerical type work, different mundane type work, but definitely can help across the board with so much. I think we talk about it in different other areas, but in healthcare, maybe it hasn't been strongly looked at. But with these shortages of staff and so forth, and retention, and just a better workflow and providing the best possible care is definitely worth looking at. So that's going to be it for this video, guys. But like I said, this is a very interesting topic. I may produce another video on this topic. Let me know your thoughts down in the comment section. I will be putting the links to the videos for Moxi, and I will put down the articles that I looked at regarding this topic in the description, so you can check it out for yourself. And that's gonna about do it for this video. Like I said, comment down below, what do you think about AI in healthcare? Do you think this is a good thing, or what are your thoughts? Like, let me know, because I'm interested and I want to know what you guys think. So comment down below and let me know, what are your thoughts. How would you feel if Moxi came to visit you and bring you a blanket, or you had Moxi working in your hospital, or you were a patient and you were in the room and Moxi came by and just gave you your blanket and delivered some things to you? How would you feel the, Moxi was there around you? That's just interesting. So, all right, guys, that's going to do it for this one. And I am Janine Glenn. Like I said, I'm a nurse. I've been a nurse for 19 years. So this is very relevant information. So I will talk to you guys on the next one. Stay well, be blessed, and that's it, guys. I'll see ya. Bye-bye.